Bismillahirrahmanirrahim. So we are now going to the third question of the series of quiz, which we are doing in relation to hypertension. So again, what I am going to do, I'm going to give you the first question, which is there on your screen, which you have to decide. And the pointer in relation to these options, we have pointed one option out of that. It may be right or it may be wrong. So you have to pick the right answer out of these four options. Let's read the question. Which of the following is recommended in the clinical evaluation and assessment of hypertension? Mediated organ damage in patient with hypertension according to 2018 guidelines from European Society of Cardiology. Now, whenever we deal with a patient of hypertension, we know that our hypertensive patient may have problems with the target organ. Commonly, the organ which a hypertension can involve, we all know that all major organs like heart, kidney, brain, eyes, peripheral vasculature. So that means in an hypertensive patient, we have to do workup in relation to see whether these organs are involved or not. Now, looking at these questions, like first question is related to echocardiography, that whether echocardiography is recommended in all patients with hypertension or not. Don't know. Let's see the answer. Then measurement of urine albumin oblique creatinine ratio is only recommended in patients with hypertension who also have diabetes. So that means that addition of this or only recommended in such condition, that is again creating some doubts about this stem as well, whether it's right or no, I don't know. Then ultrasonography of the carotid arteries is contraindicated in asymptomatic, I don't know. And I'll give you description of each stem as well, so that you will be knowing when to order these things in which condition according to the updated guideline. Last is fundoscopy is routinely recommended in patients with hypertension who also have diabetes, a neglected part for hypertensive patients. We very rarely do fundoscopy on our patient, and if we can't do, we should be asking our colleague which are and here you see the right answers. So right answer is this one. Fundoscopy is routinely recommended in patients with hypertension who have diabetes. Whether it's the first day you have diagnosed your patient with hypertension, you have to check this patient's fundus, and if you can't check by yourself, refer him to your colleague, the ophthalmologist, to see whether he's having any problem with the fundus or not. So a hypertensive who's already diabetic, he should have his fundus checked. Let's see the other stems. Like ultrasonography of carotid arteries is contraindicated in asymptomatic patient with hypertension? No, because if your hypertensive patient have evidences of atherosclerotic cardiovascular disease in other territories, and if he's old age as well, then he should have this ultrasound of this carotid arteries. So other atherosclerotic disease or very old age should have this as well. Measurement of urine albumin, I think this kind of thing, that measuring creatinine, urinary albumin, is indicated in every patient of hypertension to look at the status of renal function. And this is obligatory, because this renal function can be compromised as a consequence of hypertension, as well as it can be a cause of hypertension. So always check for urine and for creatinine and their ratio and the creatinine clearance calculation. That's obligatory for everyone. Now, echocardiography is recommended in all patients with hypertension? No, it's not recommended for all patients. It is recommended if your patient has evidence of heart failure, LV dysfunction, SOP, heart failure, both evidence in terms of on clinical judgment. He is having evidence of HFrEF or HFpEF, or you want to judge left ventricular hypertrophy. You're thinking, assuming that this is prolonged hypertensive and this LVH, and this LVH assessment is going to have impact on your management. Then echo. So echocardiography is not indicated for all hypertensive patients. So in conclusion, I would say that whenever you see a patient with high blood pressure, always think of these 5 major organs: heart, brain, kidney, peripheral vasculature, and eyes. And we have seen that if your patient is having diabetes along with hypertension, always check for fundus. Peripheral vasculature, yani atherosclerotic cardiovascular disease, then check for carotid as well. Kidneys should be assessed in every patient by means of doing urine DR and creatinine. Brain, it depends on patient status. Heart depends on patient clinical status. So that means always keep an eye of the consequence of hypertension by affecting all major organs. That's very important. So with that, we have covered our third quiz. We are remaining with 2. In the first, we cover blood pressure measurement, which I want you to go through very comprehensively how to measure blood pressure. In second, we discuss etiology. Always search for etiology. Although majority of the time it's essential, may have always try to get clues through preliminary investigations, ECG and others, that what you can do for your patient. And third, today we covered complications. And with that, I'm ending and just giving you always go through in your patient with some basic investigations, like these 4. These few investigations should be done in your patients who's having hypertension. What are those? Let's see. I think right now this slide is not appearing, but here it is. Always try to assess your every hypertensive patient with these basic investigations. They will give you an idea about some clues towards secondary causes, some clues towards complications. So that means every hypertensive patient needs a comprehensive assessment in terms of confirming diagnosis, etiology, complications, and other comorbidities. Thank you again for